Vision problems affect 1 in 20 preschool-age children, and 1 in 4 school-age children have a vision problem. However, young children with vision problems often don't know the way they see the world isn't the way everyone sees it. Without early detection and treatment, children's vision problems can lead to permanent vision loss and learning difficulties. Let's take a look at the vision problems that can affect children.
The earlier we detect a possible vision problem, the easier it is for the person who's going to treat that child to correct the problem. If I have a child who's 2 years of age and I detect a problem, it'll be much easier to correct that problem and possibly correct it to 20/20 vision than if that child was 8 or 9 years of age. So the earlier we detect the problem, the easier it is to treat that problem. If a child cannot see, what the teacher is writing on the board or read what is in the book, it's going to be impossible for them to learn the material. We have children who cannot see and may be misdiagnosed with learning disabilities, when in reality they are just having problems seeing. So a child who does not see well cannot function in the world of seeing and learning from a teacher or from a book.
There are really a number of different things that affects children and at different ages. We worry about amblyopia or lazy eye in children in the preschool period, because if a child has a large amount of uncorrected refractive error, which is essentially nearsightedness, meaning that things far away are not clear, farsightedness, children may have some more difficulty reading or doing long-term close work. Stigmatism, which can actually create some blur both far and near. We also worry about focusing skills, and last but certainly not least is the ability to use your eyes together or binocularity.
Refractive errors. A refractive error is a defect in the optics of the eye that results in a lack of precise focus of the light rays of the retina, causing a blurred image. Light rays entering the eye cannot be brought to a single focus. Instead, they may focus in front of, in back of, or irregularly on the retina. Myopia, nearsightedness. Myopic or nearsighted people generally can see near objects clearly, but distant objects are out of focus. This is the result of a refractive error of the eye in which the image of a distant object is formed in front of the retina and cannot be seen distinctly. Near objects are seen more clearly than distant objects. Hyperopia, farsightedness. Hyperopia occurs when the eyeball is too short. The reduced length means the point of focus lies beyond the back wall of the eye, and the light rays are not yet in focus when they arrive at the retina. Hyperopic or farsighted people generally can see distant objects clearly, but near objects are out of focus. In more severe cases of hyperopia, even distant objects can be blurred. In astigmatism, the curvature of the cornea and/or lens prevents light rays from focusing on a single point on the retina, resulting in a blurred image. As the curvature of the cornea becomes more uneven, image distortion increases. Visual acuity is poorer for near and far objects. Strabismus. Strabismus refers to eyes that are not straight or properly aligned. As a result of eye muscles not working together, one eye may turn in, cross eye, turn out, wall eye, turn up, or turn down. Esotropia, inward deviation, is the most common form of strabismus. The deviation or eye turn may be constant or come and go. In some instances, it alternates eyes. First one eye turns and then the other. In very young children, there often is an appearance or false or pseudostrabismus caused by a wide spacing of skin between the eyes that covers more of the white of the eyes than in adults. Pseudostrabismus is a common source of vision screening over-referral that can be prevented by a correctly performed vision screening. It is critical for strabismus to be diagnosed and corrected at an early age, because children with uncorrected strabismus may go on to develop amblyopia, a loss of vision in an eye that has not been used. In young children, strabismus may vary not only from one day to the next, but during the course of a single day. The condition usually will worsen if the child is ill, upset, or tired. Strabismus affects approximately 3 to 5% of children in the United States. Half of those with strabismus are born with the condition, or usually develop it within the first 6 months of life. Some of the most common causes of strabismus are birth injuries, heredity, faulty muscle attachments, need for glasses, and illness. Strabismus sometimes can be found in conjunction with cerebral palsy, prematurity, and other neurodevelopmental conditions. 3 out of 4 children with cerebral palsy have strabismus. Amblyopia. Amblyopia is a term from the Greek amblyos, meaning dull, and opia, meaning vision. It is sometimes referred to as lazy eye. It is a developmental problem defined as reduced vision in an eye even though the eye itself is normal. Amblyopia is reduced vision in an eye that has not received adequate use during early childhood. An estimated 2 to 5% of the general population suffers from this visual impairment. If not treated early enough, an amblyopic eye may never develop good vision and may become functionally blind. Amblyopia can't simply be corrected with glasses because the problem is in the brain. Normal vision depends on combining images from both eyes in the brain, stereoscopic vision. A condition that causes amblyopia and is left untreated until about the age of 6 most often will result in some permanent visual impairment. However, it is important that the treatment of amblyopia be pursued until at least age 10. The critical age for treatment to prevent permanent vision impairment varies from individual to individual. The earlier the treatment is started, the more likely it will be easy and successful. Amblyopia is detected by finding a difference in vision between eyes. Treatment involves 2 steps. First, correct the underlying vision problem. Second, correct the amblyopia by retraining the brain. Causes of amblyopia. Any condition that causes the brain to receive images of unequal quality from the 2 eyes can lead to amblyopia. Strabismus can lead to amblyopia. When one eye turns while the other is in straight gaze, a double image is sent to the brain. The brain solves the confusion by ignoring the message from the turned eye, which weakens from lack of use. Amblyopia can also be caused by anisometropia, unequal refractive error. Both eyes may be nearsighted or farsighted, but to differing degrees. Alternately, one eye may be farsighted and the other nearsighted. When there's a marked difference in refractive error between the eyes, the brain sees differing images from the 2 eyes and eventually ignores the eye with the poorest images. Other factors causing a difference in image quality between the eyes, such as cataracts or drooping eyelid, ptosis, can cause amblyopia. The brain suppresses the image of poorer quality, causing permanent vision loss in the affected eye, unless treated.